From the studies done so far, it can be concluded that brexpiprazole can be an effective monotherapy for schizophrenia and as an adjunct to other antidepressant medications in major depressive disorder. In this video, let's find found. What is brexpiprazole? What class of drug is brexpiprazole? What is brexpiprazole used to treat? Who cannot use brexpiprazole? What are the side effects of taking brexpiprazole? How does brexpiprazole make you feel? How to use brexpiprazole? What is brexpiprazole? What class of drug is brexpiprazole? Brexpiprazole, sold under the brand name Rexulti among others, is an atypical antipsychotic. It is a dopamine D2 receptor partial agonist and has been described as a serotonin, dopamine activity modulator. Brexpiprazole is used to treat the symptoms of schizophrenia in adults and children 13 years of age and older. It is also used with an antidepressant to treat depression when symptoms cannot be controlled by the antidepressant alone. Brexpiprazole comes as a tablet to take by mouth. What is brexpiprazole used to treat? Brexpiprazole is indicated as adjunctive therapy to antidepressants for the treatment of major depressive disorder in adults. It is also indicated for the treatment of schizophrenia in patients 13 years of age and older. Brexpiprazole is also indicated for the treatment of agitation associated with dementia due to Alzheimer's disease. However, it is not indicated as an as-needed (PRN) treatment for this condition. Who cannot use brexpiprazole? Brexpiprazole is contraindicated in patients with a known hypersensitivity to brexpiprazole or any of its components. Reactions have included rash, facial swelling, urticaria, and anaphylaxis. Elderly patients with dementia-related psychosis treated with antipsychotic drugs are at an increased risk of death. What are the side effects of taking brexpiprazole? Brexpiprazole may cause side effects. Tell your doctor if any of these symptoms are severe or do not go away. Headache, constipation, heartburn, tiredness, uncontrollable shaking of a part of the body, dizziness, feeling unsteady, or having trouble keeping your balance. Pharmacodynamics. Brexpiprazole is an atypical antipsychotic agent used to ameliorate the symptoms of psychiatric conditions, such as cognitive deficits and affective symptoms. How does brexpiprazole work? Brexpiprazole is an atypical antipsychotic agent used to ameliorate the symptoms of psychiatric conditions, such as cognitive deficits and affective symptoms. Although the exact mechanism of action of brexpiprazole in psychiatric disorders has not been fully elucidated, the efficacy of brexpiprazole may be attributed to combined partial agonist activity at 5-HT1A and dopamine D2 receptors, and antagonist activity at 5-HT2A receptors. Brexpiprazole binds to these receptors with subnanomolar affinities. These therapeutic targets have been implicated in psychiatric conditions such as schizophrenia and depression. Partial D2 receptor agonism allows the drug to stimulate D2 receptors under low dopamine conditions, while attenuating their activation when dopamine levels are high. Partial agonism at 5-HT1A receptors may be tied to improved memory function and cognitive performance. Antagonism at alpha-adrenergic receptors has also been implicated in schizophrenia and depression. Half-life. After multiple once-daily administrations, the terminal elimination half-lives of brexpiprazole and its major metabolite, DM3411, were 91 hours and 86 hours, respectively. How to use brexpiprazole? Schizophrenia. Indicated for treatment of schizophrenia. Days 1 to 4, 1 mg PO q-day. Day 5 to 7, titrate to 2 mg q-day. Day 8, titrate to 4 mg per day based on the patient's clinical response and tolerability. Target dose, 2 to 4 mg PO q-day, not to exceed 4 mg per day. Periodically reassess to determine the continued need and appropriate dose. Depression. Indicated an adjunctive therapy to antidepressants for major depressive disorder, MDD. 0.5 mg or 1 mg PO q-day initially. Titrate according to clinical response and tolerability in weekly intervals to 1 mg per day and then up to 2 mg per day, not to exceed 3 mg per day. Periodically reassess to determine the continued need and appropriate dose. Agitation associated with Alzheimer dementia. Indicated for agitation associated with dementia due to Alzheimer disease. Days 1-7, 0.5 mg PO q-day. Days 8 to 14, increase to 1 mg PO q-day. Days 15, increase to 2 mg PO q-day. Target dose, 2 mg PO q-day. May increase to maximum recommended dosage of 3 mg q-day after at least 14 days, based on clinical response and tolerability. Are there specific concerns about brexpiprazole and pregnancy? AUTGA pregnancy category C drugs which, owing to their pharmacological effects, have caused or may be suspected of causing harmful effects on the human fetus or neonate without causing malformations. Breastfeeding is not recommended during use of this drug because it is excreted into animal milk. That's all the information about brexpiprazole we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.